Welcome, everyone. Thank you so much for joining us this evening. We are glad to be here with our expert panelists at your Ask the Doc Town Hall. We will get started and we will give you an ample opportunity to hear from our panelists and ask all of your questions about the COVID-19 vaccine in adolescents, post-COVID follow-up, and some of the psychological aspects post-COVID. So we are going to get started with a couple of facts. Why are we here? Why is this still important? We've been talking about this for a long time. We've been in the midst of this for a long time. And the good news is we are making excellent progress, especially in Wake County, in the race to vaccinate. Based on the latest data today, we are only about 900 people away from having 70% of our adult population, 18 plus, vaccinated with at least one dose of a COVID-19 vaccine. We hope that we reach that 70% mark this weekend. While Wake County is in one of the top 3 counties for vaccinations in the state of North Carolina as a whole still has a lot of work to do. We only have about 44% of our adults 18 plus with at least one dose in the state, so not even half of the adult population. And as you may have heard, there is new heightened concern about the Delta variants that the CDC has been mentioning in the news, which is thought to be responsible for nearly 10% of all the new cases in the United States. And this variant is more contagious, spreads faster, and gets people sicker. And so we really need to be on top of this vaccination campaign. And so that's why we're here today, because there's still so much work to do. Additionally, we know that in African Americans and our Hispanic population, our numbers are not the same as in the general population. While African Americans are 17% of those vaccinated in Wake County, we represent more like 23% of the population. And so similar margins exist in our Hispanic Latinx communities. And so we still have lots of work to do. I'm going to take a second before we get started to lay some ground rules for this town hall. And I'm going to ask Lachelle Wardell to show her screen and show some of those guidelines, but keep in mind that this is a community event and we need to be respectful of other participants in our actions and words. Remember that we are all learning, so please don't hesitate to be curious, send questions and comments. And finally, we want everyone to enjoy themselves and feel safe, and we will take the appropriate measures to ensure our collective well-being during this time. Excellent. Lachelle, I'm going to also hand it over to you at this time to introduce the poll that we will have people answer during the town hall.
Great, thank you so much, Dr. Monroe. So I will ask you now, before we get started with tonight's poll, if you don't mind, and we've posted in the chat on both YouTube and Facebook, this URL. So if you could just use whatever device you're on, your cell phone, your laptop, and just log in and take this quick poll for us. We will reveal the results at the end of the town hall tonight. I'll leave it up for just a second. Once again, the link is being posted in the chat. And then we ask you to please take a few moments to complete that. Thank you, Dr. Rasheeda. I will turn it back over to you.
Excellent, Lachelle. Well, let's go ahead and get started. I am going to start introducing our panelists. And first, we will have Dr. Stefanie Etienne. She is a board-certified family physician who has been practicing in the Raleigh area for over 16 years. For over 12 years, she has served as the lead physician for the Wake County Health Services Regional Center Clinics. She is also an urgent care physician for UNC Urgent Cares. She has a passion for caring for the underserved communities and has demonstrated this by practicing in these communities her entire career. I was lucky enough to work with Dr. Etienne this year as she volunteered with the WakeMed COVID-19 strike teams and worked tirelessly to help vaccinate Black and Hispanic citizens in the 27610 zip code, one of the hardest hit zip codes in all of North Carolina. Dr. Etienne, I'm going to turn it over to you, and why don't you just give us a little information about why this work is so important to you?
Thank you, Dr. Monroe. As a family physician, I care for patients of all ages. And in particular, I work in the underserved community, and I care for patients who have lack of access to care and many who have had lack of access to vaccination. I've seen patients who have dealt with a variety of illnesses. And for the most part, my patient population is a younger population, pediatric and young adult females. And there is a huge misconception that young people, and particularly children, don't get COVID and they don't die from COVID. And unfortunately, I've seen countless cases of COVID in my patients. And also I've actually lost a few patients due to COVID. You know, we've all dealt with COVID. It's impacted our families. We may have suffered from COVID ourselves. We may have had family members who perished due to the disease. So it's important that we continue our efforts. We have 3 vaccines out now, and our numbers have curtailed somewhat as far as cases of COVID and deaths, but we still have a lot of work to do. I'm very concerned in particular regarding people post-COVID as far as dealing with post-COVID complications. And as we started off with the effort to test people and vaccinate people, people of color have been marginalized and have been tested and vaccinated at a disproportionately low rate. And there is huge concern that people of color, in particular Black and brown people, will also have disproportional rates of evaluation and treatment post-COVID. And this can lead to additional deaths. So I'm happy to be here today to share in the discussion to help people recognize what symptoms are more severe and things that need to be addressed, and so that they can be informed and also inform others so that we can hopefully prevent a huge disparity from developing. And thank you.
Thank you so much, Dr. Etienne, and we look forward to hearing more about that as we go forward in this town hall. Next, I will introduce Dr. Ernestine Briggs King. Dr. Briggs King is a director of research at the Center for Child and Family Health, director of the Data and Evaluation Program at the UCLA Duke University National Center for Child Traumatic Stress, director of Diversity, Equity, and Inclusion, and is an associate professor in the Department of Psychiatry and Behavioral Sciences at Duke University School of Medicine. She's a clinical community psychologist with a doctorate from the University of Illinois at Urbana-Champaign. As part of her current work, she's involved in implementation, dissemination, and evaluation of evidence-based strategies aimed at reducing the sequelae associated with maltreatment and child traumatic stress. She also has expertise in the area of cultural, gender, and systemic issues. Thank you so much, Dr. Briggs King, for being here with us tonight. Give us a little bit of insight into what you've been seeing and why you think this work is so important.
Yeah, thank you for inviting me. You know, over the last 15 months with the global pandemic, it's been a lot of highs and a lot more lows, right? And with more than 33.5 million people infected with the coronavirus in the United States alone, COVID has really challenged us in many ways, and particularly as it relates to mental health. You know, staying safe during the pandemic not only meant washing our hands, it also meant lockdowns and quarantines, social distancing, and disrupting important social connections to lower the risk of transmission to ourselves and those we love. COVID changed the way we educate our children, right? So many of us as caregivers became teachers. For most of it, it widened existing disparities in access and opportunities to learn. And for many of our youth, it disrupted and changed just many of the key developmental milestones, things like graduation and prom, college tours, work opportunities, or just simply hanging out with friends. It changed the way we worked. It changed the way we received care. It changed the way we worship. It changed the way we connected to each other. So our new normal was marked by many new experiences and filled with lots of uncertainty. We also experienced lots of loss, right? Loss of routines, connections, employment, homes, and loved ones. For some of us, there was trauma, abuse, and violence. And for many of us, we are grieving. We're grieving all the losses that we had, all the people that we've lost. And so thinking about this and thinking about the impact of COVID-19, and then layering on all the other things that have happened to us. So we lost all those people to COVID, but there are people that we've lost to other situations such as suicide or homicide, drug overdoses, and health and other mental health conditions. I think the pandemic has really highlighted and widened existing disparities and disproportionalities. And, you know, I don't know how many of you have heard this, but there's an old adage that says, when white America catches a cold, Black America catches pneumonia. And so we saw people of color, they were more likely to get sick, have a severe course of illness, or die. It wasn't enough that they were also at heightened risk for a range of secondary adversities. And we're seeing this in terms of economic, social, and health consequences. You know, I'm a trauma person, so I always think about the pandemic as being in the context of other traumatic events or other compounding adversities that have exacerbated these conditions. This includes everything from child abuse and domestic violence to natural disasters, right? We saw the floods, the wildfires, even ice storms in Texas, to heightened levels of racism, discrimination, and social injustice. The toll on our mental health has been unprecedented. The stress that many of us contend with on a daily is palpable. Although the data are not in yet, we are seeing rising rates of depression, anxiety, post-traumatic stress disorder, suicide, and substance use. We see a large proportion of our community, our Black and Brown, our people of color, headed towards breakdowns versus breakthroughs. As the world opens back up, it's critically important to understand how vaccination plays a role in our recovery and folks getting their mental health needs met. I realize when it comes to mental health, accessibility, availability, and affordability are big barriers that we have to overcome. We also have to address the stigma or shame we attach to seeking help. How many of us grew up in households where we were told not to air our dirty laundry, or where family members or friends struggled with mental health issues, but we just didn't talk about it or even encourage them to seek help? So we don't want to appear frail by asking for help. We don't want to enter a system that may create opportunities for rejection, humiliation, or even deportation. So instead, many folks suffer in silence. We have to change this, though. We have to let folks know that they don't have to suffer in silence. There are high quality treatments that work, that are available. And as practitioners, we have to be aware of our own biases.
Yeah.
Become culturally and linguistically competent to meet the diverse needs of people of color. I hope
Dr.
during
King, Dr. Briggs King, those are excellent, excellent points that you're making. And I want to give you plenty of opportunity as we move forward to talk more about that. For now, I want to keep us moving so we can get everyone introduced and have plenty of time to give our attendees opportunity to ask questions. But thank you so much. I felt the passion and all that you were saying, and you were just right on the money with that. I want to move on and introduce Dr. Jamila Fletcher. Dr. Fletcher is a native of Raleigh, North Carolina, and a graduate of Enloe High School. She earned her BS degree in biology from Duke University as a prestigious B. N. Duke Leadership Scholar. She earned her medical degree from UNC School of Medicine. She remained in Chapel Hill for her pediatric residency training. During her residency training, she was designated as an Ambulatory Pediatrics Association New Century Scholar, recognizing her as a potential leader in pediatrics with an interest in areas of cultural competency and health disparities. She now works as a partner in private practice at Raleigh Children and Adolescents Medicine. For over 50 years, RCAM, as we lovingly call it, has specialized in state-of-the-art pediatric care for children from birth to adolescence. In the community, she's an active member of Baptist Grove Community Church and also served as a volunteer on the health equity team delivering COVID-19 vaccines to marginalized communities. Dr. Fletcher, thank you so much for joining us tonight. And do you just want to briefly tell us why this work is so important to you? How have you been involved and why is this so important to you?
Thank you so much for inviting me and for that warm introduction, Dr. Monroe. As a pediatrician, basically vaccines have been at the foundation of my profession. For decades, pediatric vaccines have essentially eradicated a long list of diseases that used to kill and disable children at alarming rates. There are now generations of parents and physicians who've never witnessed firsthand many diseases because of the success of vaccines. A list of diseases like Haemophilus epiglottitis, pneumococcal pneumonia, whooping cough, bacterial meningitis, polio, just to name a few. And the development of vaccines has been touted by many scientific publications as the top medical advancement in human history. And personally, I also want to mention that I want, as a testament to my trust in science and vaccines, that I was one of the 44,000 Pfizer phase 3 study participants. So in the fall, I got my study injections. And thankfully, I was unblinded and I was given the vaccine. So I'm 8 months out from my second Pfizer shot. And I will be continued to give blood samples to check for titers, which I've done 6 months out. And it has been shown to be affected at least 6 months out. And I'll talk a little bit more about that if the audience is interested. And then at the front lines as a pediatrician, I do COVID testing. At a curbside clinic that we created specifically for this virus. I test children who've been exposed to the vaccine, whether that's in sports or in school, in their families. I also treat COVID-19 patients after their infection, as well as screen athletes that need to be cleared for sports participation because of the risk of myocarditis after COVID-19 infection. And then lastly, I think it's very important for the audience to know that I am a mother of 3 and my older children are vaccinated and my youngest is now also a part of the Pfizer study for the 5 to 12-year-old population, along with close to 5,000 other children in this country. So I'm very happy to be here and I'm open to any questions that you have.
Dr. Fletcher, thank you so much. And thank you for bravely moving forward with the Pfizer vaccine before any of us were vaccinated and you know, donating yourself to science for our benefit. We appreciate that. I want to introduce our last panelist, Dr. Ed Ocran. Dr. Edward Ocran, PharmD, has been a pharmacist at WakeMed for the past 14 years. He has served in different roles with the last 11 years in leadership at WakeMed. He is currently the pharmacy manager for WakeMed Cary Hospital, where he oversees all pharmacy operations. He is also a part of the pharmacy team that's assisting with COVID vaccinations throughout WakeMed and in the community. And Dr. Ocran, it was an absolute delight to work with you this year as we were doing these strike team community vaccination efforts. We really appreciate your expertise and are glad to have you here with us tonight. Dr. Ocran, do you want to just give us a little bit of information about why this work is so important to you?
Thanks for the introduction. As a pharmacist, part of what we do is make sure people understand medications, they understand the safety of medications and why it's important to take it. We've all seen what COVID has done to our community, hundreds of thousands of people that passed away and millions that recovered from COVID and most likely going to have long-term effects from COVID. So I think, if there's any little part I can play to help people, convince people that, vaccination is the way to go versus the alternative, then I'm always willing and able to do that. So I appreciate once again being part of the panel.
Excellent. Thank you so much. So we're going to get started with our questions. If you are joining us on Facebook Live or via YouTube, please put your questions in the chat there. We will do our very best to get everyone's questions answered. Please don't forget to answer the poll that Lachelle Wardell has placed in the chat on those two services. But we're going to start with the first question. And Dr. Fletcher, I want to send this question your way. This question is from Reagan Mahoney Colleen. Reagan states, I keep reading that the data does not show any relationship of vaccine to infertility. This does not help me, as it could just be too early to see an increase in infertility or miscarriage, as vaccine started 6 months ago. I would like to hear, how is it scientifically impossible for the vaccine to affect my 13-year-old's future fertility?
Oh, right. So Reagan, that's a fantastic question, and I appreciate you asking it. From a science, let's just break it down into a scientific standpoint. In order to affect fertility and reproduction in a teenager, there has to be some damage or alteration of the DNA. And while these vaccines, Pfizer and Moderna, are mRNA vaccines, they do not go into the nucleus of the cell and they do not alter DNA. So scientifically, they cannot affect fertility. They do not damage DNA. Essentially, it's a blueprint, mRNA, to tell your child's body how to make the spike protein so that your child's own body makes antibodies. And mRNA is present in our body naturally. So none of this is anything that would be foreign to the body. And you do mention that out in the public, it's been available, the vaccines, for 6 months, but they have been studying the original Pfizer study vaccine participants like myself, who are more than 8 months out now. And we continue to monitor any adverse effects, including fertility and miscarriage. And at this point in time, 8 months out, we have not seen any effect negatively on fertility.
Thank you, Dr. Fletcher. So what I'm understanding you to say is, one, we've not seen any effects in the studies, which were now 8 to 9 months out, as far as decreased fertility. But even scientifically, when we think about this, it's impossible because what's being introduced into your body from the vaccine cannot enter the nucleus of the cell, which is where the DNA is housed. That's how I understood that. Is that what you're saying?
Spot on. That is exactly what I'm saying.
Awesome. Awesome. And, people have a lot of questions like this, and I know that people are concerned. We're talking about our children. I'm going to stay with you, Dr. Fletcher, because there's another pressing concern that people have, but I promise I'm going to open it up to everybody, about myocarditis and pericarditis. So you've been hearing about this maybe in the news in children. And Dr. Ocran, I might send this to you also. But can you tell us what, should we be concerned about our adolescents getting vaccinated? Does it cause heart disease?
So far, there's not been any direct correlation of myocarditis to the vaccine. Obviously, the CDC is still collecting a lot of data, but based on the data that they've collected so far, the incidence is very low. A good way to look at it is if you have two towns, town A and town B, both with 100,000 inhabitants. If you vaccinate all 100,000 in town A, only 2 out of the 100,000 is going to end up with myocarditis. In town B, if you don't vaccinate anyone, probably around 1,200 to 1,300 is going to end up with COVID. And within that population that end up with COVID, a certain amount of them are still going to end up with myocarditis anyway, because COVID disease by itself causes myocarditis. So, I think the incidence, it's low. And if you compare that to COVID itself, you're way off better getting the vaccine versus worry about a myocarditis. I think eventually, as the CDC collects more data on it, there is, they're going to come up with some guidance if they think, one, if there's a correlation, and if there's a correlation, how to, deal with that to make sure the incidence is even further low.
Thank you, Dr. Ocran. Dr. Fletcher, did you want to add something?
Just that even in the cases of the rare incidence of the side effect of myocarditis after the vaccine, it is mild and transient. In many cases, do self-resolve.
Yep.
So Dr. Ocran already gave us the numbers that were very helpful. Just basically that you don't want COVID and you should trust the vaccine more than the actual virus itself.
Yeah, that's really helpful. Thank you, Dr. Ocran and Dr. Fletcher. I like your example of the two towns. It really helps people to put that into perspective. I will, volunteer that my adolescent, my 14-year-old, got vaccinated, and I was thrilled, as was he, to get to give him that opportunity. For us, it means the return to social interactions and sports and other activities safely. So we're so happy to have that opportunity. And I also felt really good about the data that you mentioned, that Dr. Fletcher, that even in the cases of adolescents who have had pericarditis or myocarditis, it's been very brief and resolves on its own. So that was very comforting to me. And you and I, we all have seen over the past year, people have gotten really, really sick and obviously died from COVID, but even children with MIS-C admitted to the PICU, the intensive care unit. So the COVID virus itself, of course, is very dangerous. This next question will go to Dr. Etienne. This question comes from Ms. Vielka, Maria Gabriel. I have an 80-year-old client whose family refuses to have him vaccinated because he has a heart condition. What are your thoughts? Should people with heart conditions be vaccinated? Dr. Etienne, how would you advise them?
Most definitely, they need to be vaccinated. COVID can affect all of our body systems. People who are elderly are at a higher risk of developing complications. High risk complications from COVID. They're more likely to be hospitalized due to COVID, and they're more likely to die due to COVID infection. We've seen that across the board. This vaccine has been studied in elderly people, and millions of elderly people have received the vaccine so far. And as we've seen in all people who have received the vaccine, there are not many cases of significant side effects. Most side effects are mild, and the vaccine is not going to cause any effects that will worsen their conditions. If the grandpa were to get COVID, they're at higher risk of cardiac complications. And post-COVID, even if they get COVID and their symptoms aren't very severe, because they are older and they do have underlying medical conditions, they're more likely to have lasting effects of COVID that can cause deterioration in their health. And unfortunately, it can lead to increased chances that they may actually perish from the virus. So I would wholeheartedly recommend that they be vaccinated. There are people of all ages who've been vaccinated. We've had people 100+ years old who've been vaccinated, and they did fine. The risk of having serious complications due to infection with the vaccine highly outweigh the risk of potential mild side effects that should resolve on their own. So I definitely recommend that they be vaccinated.
Thank you, Dr. Etienne. And you reminded me of when Dr. Fletcher vaccinated a woman who was, I think, turning 106 that day, if I remember correctly. So you're right, we have vaccinated many people of all ages. But I love the point that, this vaccine is for this 80-year-old client, right? The people who do have those high risk conditions are the people who really do need the vaccine. So certainly don't withhold because he has heart condition. He should be first in line because he has his heart condition to help get him protected. Let's see, Dr. Briggs King, I want to send this question to you. I wonder if you have any tricks, tips, suggestions you can offer to Ashley Sharon Murr. She says, I am currently trying to convince and encourage my 16-year-old to be vaccinated. As a research scientist, I have faith in the process. So there's a lot of hesitancy, right? We know there's hesitancy in our adult population, but many of our adolescents too are worried about this, and some are first in line saying, "Ooh, pick me so I can get back to activities," but others are really worried and nervous. So, how would you address this? What would you say to Ashley's 16-year-old to help convince them to get vaccinated?
Yeah, I think part of the process is providing them with information. And as you said, most of the teens out there are chomping at the bit to try and get back some sense of normalcy, some sense of routine. So I think I would encourage her to have a frank conversation with her daughter and see what are her concerns, what are her fears, and provide her with information. I love the fact that we're doing this panel because we're providing needed information to the community. And so addressing those in developmentally friendly way to really kind of address her fears and provide her information and about her concerns would be something that I would strongly urge her.
What do you think? Can Ashley bring her child in to see her primary care physician to have this discussion, or is that is that not something you'd be willing to do, or is that in your wheelhouse?
Oh yes, most definitely. The teenagers tend to respect and look up to their physicians, and they confide in us regarding their fears, and they're more likely to be receptive to what we have to say. And we're knowledgeable about these vaccines, and we have multiple patients who've been vaccinated already. My daughter is 14 years old. She's been vaccinated. She was chomping at the bit to be vaccinated. So I think it's a good idea to bring them to the doctor, just as you would bring your child to the doctor for a physical. Bring them in for a visit to talk about the vaccine and hopefully get the vaccine the same day. I think that would be a good strategy.
And I completely agree with Dr. Etienne. You have a relationship with our patients. And there's already a normalcy when they come in to get their meningitis vaccine. So it kind of reminds them of that, pre-COVID shot that they got. And so it also tells them that this is about prevention and that a trusted messenger is recommending this. We can ask the questions in an honest, open way that is developmentally appropriate so that they do get the answers to the concerns and fears that they may have.
Thank you so much, Dr. Fletcher and Dr. Etienne. This next question, I'm not sure who I'm directing this to. Dr. Ocran and Dr. Etienne, listen to this. Hello from YouTube. Thank you for your participation tonight, panelists. After getting a COVID-19 vaccine, will the person test positive for COVID on a viral test or antibody test? So after getting the vaccine, if you get a COVID viral test, will you be test positive or an antibody test? Who wants to, Dr. Ocran, you want to take that one?
Yeah, the answer is simply no. None of the COVID tests will make you test positive on any test, regardless of what is a PCR or antigen test. So it's simply no.
Excellent. Thank you. Let's see. Dr. Etienne, I'm going to send this one to you. There's several questions about children with certain health conditions like behavior problems, autism. And the question is it safe to vaccinate my children if they have X disease, including, a child with autism?
There are no contraindications as far as diseases to getting the vaccine, be it if a child is autistic, if they're diabetic, if they have asthma. Actually, those are conditions that put them at higher risk of complications from COVID. So there's no reason to not vaccinate them.
Thank you. And then Dr. Fletcher, this participant says, my child is in sports and there will be unvaccinated teammates around them. How do I keep my child safe during this time? I'm assuming that they're saying that their child is vaccinated, but the teammates are not.
Right. And so obviously in a pandemic, there's going to be no zero risk activity. But sports where you can naturally social distance, that are outdoors, where people are wearing a mask, those would be lower risk. But vaccinating your child would be the number one thing that you can do to protect them, because these vaccines are higher than 90% effective. So even if they are exposed, the chances of them getting the disease is going to be very low.
Along those lines, should people who are vaccinated still be careful with, indoor activities and social gatherings with people who are not vaccinated? Or once you have the vaccine, Dr. Fletcher, are you free and clear to do whatever you want to do with whoever vaccinated or not?
No, we still want to practice our 3 W's, washing our hands, waiting 6 feet, social distancing, wearing our mask, just because we don't really know who is vaccinated, and no one really has a stamp on their forehead to say if they're vaccinated or not. And there are these variants that you mentioned in the introductory to the panel that we're worried about. So you still want to do all of the safety measures that we've been doing throughout this pandemic when you're vaccinated. And then also I would try to limit groups to a smaller size if you're unsure, if they're not close family members and you're unsure of their status.
That's good advice. I like that. Thank you. Dr. Etienne, I'm going to send this to you. Manuela Ramos asks, I had COVID-19. I am still struggling from being sick. How much longer do I need to wait to be vaccinated?
Well, when the person is saying they're still struggling with being sick, that can mean different things. If it's been over a month since you've had COVID and you're still having symptoms like cough, shortness of breath, or chest pain, that can happen in some people. It doesn't mean that you can't get the vaccine. It doesn't mean that you're still actively infected with COVID. Most people recover from the acute phase of COVID infection within about 2 to 3 weeks. You can have continuation of symptoms beyond the 4 weeks. That is something that we tend to see, but eventually most people do have resolution of their symptoms. And that would not mean that you can't get the vaccine. And one thing that I do want to add is if you are experiencing symptoms that have worsened from the onset of your diagnosis, that would mean that you need to have additional evaluation to make sure that there are no post-COVID conditions that you're dealing with that could be potentially life-threatening. But just still having a mild lingering cough, feeling a bit fatigued, it doesn't mean that you still actively have an acute COVID infection and you still can be vaccinated. But you do want to keep an eye on those symptoms. And if you are getting worse, particularly if it's been beyond 3 months, that is more problematic and you definitely need to see a physician. And people who are older and people who have underlying medical conditions or who are hospitalized due to COVID, it's really recommended that they follow up with their physician pretty much within a week of diagnosis.
Interesting. So you're saying that even if you're still having symptoms after developing or being positive for COVID, once you're out of that acute phase where you're no longer in quarantine, you can go ahead and get vaccinated even if you're still having symptoms. But if you, after COVID disease, have long-lasting symptoms, you should be seeing your physician to be evaluated. Is that right?
Yes.
Okay. Well, that's helpful. Can you talk a little bit about kind of that ongoing evaluation? What are the recommendations for people who are post-COVID? What are they supposed to do as far as, being evaluated by their physician?
For people who had mild to moderate symptoms, who are young, who were not hospitalized, it's not recommended that you have a follow-up. If you've pretty much recovered from your symptoms within about 2 to 3 weeks, you don't have to see a doctor unless you have concerns. You have a right to see the doctor if you want, but it's not generally recommended. People who have had mild to moderate symptoms and weren't hospitalized, but are older, like 60 plus, or have underlying medical conditions, it's recommended that they see their doctor within a month of diagnosis. And when we look at people who have had severe symptoms and were hospitalized due to COVID, they definitely need to see their doctors within a week or less, depending on, the severity of their symptoms, if their symptoms are worsening. And when we look at the phenomenon that's called, long COVID or post-COVID symptoms, recent studies are showing that, it was thought that people who had, more severe symptoms were more likely to experience post-COVID symptoms. But we're finding that it doesn't matter if you've had mild, moderate symptoms or severe symptoms. Even people who were asymptomatic during what we would call the acute phase can later develop symptoms. And those symptoms can range from fatigue, that's one of the most common symptoms, and exertional, post-exertional malaise or fatigue is very common. We see that in like 50 to 80% of people when you pretty much exert yourself and then you just feel like you're just totally drained and you can't function. And those symptoms can literally last for days after the physical activity. We see people who have chest pains, shortness of breath, body aches. They have brain fog. You just feel like you just can't function. You just can't do your regular routine. You can't get through a day at work. There are huge, any body system can be affected. So particularly mental health as well. We have people who are more depressed. They just don't feel like themselves. And it just lingers, beyond that 12-week period. They're depressed, they're anxious. They may even have PTSD from dealing with, the virus for so long. So this is a real phenomenon that people are seeing. And sometimes it may be not recognized by the doctors, or people can kind of blow it off as, oh, you're fine, or this is something that you had before, you'll get over it. But that's not the case. And people really need to know that if they've had COVID, if they've had family members with COVID, they need to make sure that they are being checked up, depending on, their medical history, what they have dealt with as far as COVID, how severe their symptoms were. They really need to follow up. In a lot of cases, they need to see a specialist. They may need to go to a post-COVID medical clinic that deals with people who are dealing with issues post-COVID. Because what we're seeing, unfortunately, we're seeing young people who are succumbing to post-COVID complications. And a lot of them are people of color, because nobody is telling them to go see their doctor, or they're feeling like, oh, I'll get over this, or they're just kind of being dismissed as, oh, that's your asthma, or this is something else, that's your diabetes. Actually, no. Oh, you've had heart issues before, you'll be fine.
Dr. Etienne, that's really helpful. That's really helpful information to remind people of what can happen and how they should follow up. And I like a point you made about the PTSD and the brain fog and the kind of mental fatigue. So Dr. Briggs King, I want to take this over to you then with that segue. Have you seen people with post-COVID brain fog, PTSD, mental health issues, and what have you been seeing, and how are you helping people?
I think you see both people with post-COVID psychological symptoms and people that have just been so locked up, so locked in with psychological symptoms related to being, socially isolated, or not being able to be connected with their loved ones. So we're recommending all the good things that you all would recommend in terms of getting good sleep and nutrition and things of that nature. But we're also kind of having them look out for their symptoms and really reaching out to a professional if their symptoms are, different from what their normal day-to-day functioning is. They're having trouble functioning, having trouble sleeping, having trouble managing their emotions. Their mood swings are going from here to there very rapidly, and being able to get some mental health treatments on board is highly recommended.
Thank you both so much for answering that question. Dr. Ocran, I'm going to send this next question to you. From Juana Santiago, why do people say the second dose gave them a little of the COVID-19 symptoms? Why do people say that? What should you expect after the second dose, Dr. Ocran?
So after the second dose is when your body basically manufactures most of your antibodies. So you may experience some mild symptoms because of that. Typically to be headaches, you may feel some body aches, malaise, but it's very short period of time. I'll just tell you from my personal experience, when I got my first dose, I didn't feel anything, other than just the regular injection site pain, that's it. But in the second dose, I experienced some of those symptoms, and I slept it off. I woke up the next morning, then I was good. My wife, on the other hand, she had the opposite. With the first dose, she experienced a lot of those symptoms. Then the second dose, she was fine. So you can get it either with the first or second dose, but most of the symptoms are very transient. It's a short period of time. If you get to the point where it's not tolerable, you can take some Tylenol, and that's fine. We usually recommend Tylenol over ibuprofen, simply because of the way those two drugs works. Ibuprofen, in some cases, can sort of inhibit the bodies from making the antibodies, versus Tylenol that doesn't. So if you get into a situation where you can't really take the headache or the fever or malaise anymore, then just take some Tylenol. And typically within a day or two, those symptoms go away.
Excellent, thank you. All right, we have a few more minutes of answering questions, and we have several to get through. So team, I'm going to ask you these rapid fire. This is the rapid fire round, okay? So first, Dr. Fletcher, can my child get routine pediatric vaccines at the same time or within 1 to 2 weeks of getting a COVID vaccine?
Yes, it is safe to get vaccines. Many adults probably remember that we asked questions for the adult population if you had gotten a vaccine before your Pfizer vaccine, and that was because we were still in the monitoring phase of side effects. Now that 300 million people have gotten their vaccines, we pretty much know what those side effects are. So you can go ahead and get your tetanus boosters, your meningitis vaccines, along with your COVID vaccine or within a week or two.
Excellent. Thank you. Next, rapid fire. Dr. Etienne, I had a baby 5 months ago, and I'm worried about getting the vaccine since I'm still breastfeeding. Is it safe?
It is very safe. Since the vaccine has been given to thousands of pregnant women and breastfeeding women, there have been no significant side effects. And actually, there are studies that show that breastfeeding moms who receive the vaccine, there are antibodies that are actually present in the breast milk that come from the mom, and they basically are in the breast milk. So the baby actually receives benefits from those antibodies. So yes, the American College of Gynecology strongly supports pregnant women and breastfeeding women getting the vaccine if that's what they choose to do.
Excellent. Dr. Etienne, back to you. Is it true that children do not need parents' permission to get the vaccine?
That is true. They don't need permission, but it is recommended that the parent be involved if possible, but they don't have to have permission.
Excellent. Do you know, Dr. Etienne, of resources for Latin Americans who are afraid to be vaccinated because they fear their information will be shared with the authorities? So you work with Wake County Human Services, and tell me, how does that work? Is that information shared with the authorities? And,
No.
and what resources can people look for?
The information is not shared with anyone. Everything is confidential. No one will know that you received the vaccine unless you tell them. There are different organizations within Wake County that advocate and support the Latinx population. I don't have the list with me, but if they contact the county, they can provide them with that information. But if they come to Wake County in particular, or any site to get the vaccine, they don't have to worry about anyone receiving any information about them, and we're very supportive of getting them the vaccine.
Thank you so much. I see, thank you, Luisa Escobar from Wake County. Also other resources at El Centro Hispano, La Semilla, Southeastern, and the Wake County Human Services sites across our county. They can get resources and information in Spanish and can get vaccinated. I want to ask this question. So in the chat on Facebook and YouTube, there's a question about what about people who have died after getting the shot? You know, have people died after getting the shot? Is it caused by the vaccine? People are worried about it. So I wonder who would like to answer that question. Dr. Ocran, I wonder if you can talk to us about this. I mean, we know that 310 million doses of COVID-19 vaccines have been administered since December, and we are tracking the side effects and adverse events very, very closely through the vaccine adverse event reporting system. There have been 5,300 essentially deaths out of those 310 million doses of COVID-19 vaccine. But what do you think about that? Is that related? Does the vaccine cause death?
I think so far the data that I've looked at with regards to that on CDC's, and there's not really been direct correlation between getting vaccinated and death. I know that Johnson & Johnson vaccines can cause some blood clot, and the CDC came up with some new guidelines on how to treat that, as well as certain patient populations that may not be the ideal vaccine for. For example, if you're somebody that you have a history of blood clot, then most likely you better off getting like a Moderna or J&J vaccine versus Johnson & Johnson vaccine. But as far as direct correlation between receiving a vaccine and you're dead because of the vaccine, so far there's not been any link between those two.
Yeah, that's really helpful. Dr. Fletcher, I wonder, do you have anything to add to that? I mean, we keep a close eye on this, just like, as pediatricians and Dr. Etienne as family physicians, we keep such close eye on side effects and adverse events post-vaccines. We've seen, of course, many people die from COVID disease itself. But what do you tell people if they ask you, is the COVID vaccine associated with death?
I guess I would add that in the beginning of the vaccination effort, we were vaccinating high-risk patients, so people who already had known high-risk medical conditions. And so the mortality rate alone without a vaccine is higher than the general population. And so that can make it seem like the vaccine would cause a death. But when you look at the epidemiologic studies, the VAERS reports to see if there's a medical explanation that could potentially or plausibly be linked to the vaccine, it was not seen, except for the exception that Dr. Ocran mentioned with the J&J and the blood clots.
Yeah, that's really helpful. And that's a great point. People do die every day from a lot of things. And when we're targeting a 65-plus-year-old population with comorbidities, there is going to be a baseline rate of adverse events, whether they're vaccinated or not. So that's an excellent point. Thank you for helping us with that. We are nearing the end of our time together. I wanted to give Lachelle an opportunity to review the polling questions. Lachelle Wardell, are you there with the answers to our poll?
Yes, I am, and I will share my screen. Now, I will say that our poll participants weren't as high tonight, so you will still have the opportunity. This link will stay live, so we will encourage you to still go on and complete the poll after the town hall is over. So I'm going to share my screen and see where I've saved it here. Just give me 1 second. Oh, hold 1 second. I've got too many windows open here. So I'm going to delete this. This one. Okay, are you all seeing my screen?
Yes.
Yes. All right, so unfortunately, tonight we've only had 3 participants, but again, we wanted to hear from these 3 participants, and so we will review the results from that. So with those 3 participants, we asked you, what zip code do you live or work within? And you will see those zip codes that are represented here in Wake County. We then asked your race, and we've got a couple of African Americans and a white. We also asked what was your ethnicity. So from that, 67% were not Hispanic or Latino, and 33% was Hispanic or Latino. I like to look at the percentages versus the numbers. It makes it sound better. We also asked our participants, what population do you represent? And so we asked them to check all that apply. So we've got folks representing the general public, community organizer, and other. We also got at the age range. And so with this, most of our folks are in the 45 to 65% age range, and 33% are 25 to 45. And then we asked you, did you plan on being vaccinated? And all of our respondents tonight are already vaccinated. And then, of course, we asked if they weren't sure, but everybody's vaccinated. So we also wanted to find out who you trust to provide you with reliable information about COVID. And everyone said that they trust their healthcare worker. 2 of you said you trust your faith leader. 1 person said they trust their family or friends. Another person said they trust the radio or 2 TV news reporters. 33%, which is 1 of you, said you trust your county government officials and your state government officials and Governor Roy Cooper and President Joe Biden and Dr. Anthony Fauci and the CDC. And so those were our responses for tonight. Once again, for all of our participants, we will keep this poll live and you will be able to go back and to take the poll at any time. We look forward to having your responses. Thank you, Dr. Monroe.
Thank you, Lachelle. We appreciate you and everyone at Wake County who supports this platform, makes it possible, and helps get the information out to our community members and gives them the opportunity to ask questions of our experts. We are very thankful for your time and your expertise. We also want to thank Dr. Palovaram and Makiba Felton, who worked in the as chat monitors, answering questions on YouTube and Facebook. Also, Dr. Michelle Benoit Wilson. I am going to turn it over to you all. You have 60 seconds to make your case. Why should someone who has not been vaccinated yet get vaccinated against COVID-19? Dr. Ocran, you are first. 60 seconds. Why get vaccinated?
Because that may be the difference between life and death. Also, if you have teenagers that participate in sports, I'll use myself as an example. I have a 16-year-old that's in the marching band. I wouldn't allow her to play in the marching band during the height of the pandemic. And so as soon as vaccination was open for teenagers, she was just ready to go because she wanted to go and join her friends and able to participate in the marching band. So the vaccines are safe and it will help you get back to your normal life. So please go get vaccinated if you haven't already.
Thank you so much. Dr. Briggs King, 60 seconds. Why get vaccinated?
It's so critical to your mental health. It is so critical. We are people that thrive on connection. And I think during the pandemic, without being vaccinated, those connections were severed. So just to kind of get back on track, feeling well and being connected and being able to give somebody a hug is just so important. So I think it's just so vital to your mental health. And that's the reason I would say it's 100% why you should get vaccinated.
Thank you so much. Dr. Etienne, 60 seconds. Plead your case for people who are still on the fence. Why get vaccinated?
Vaccines save lives. The only way we're going to return to normal and put an end to this pandemic is through vaccination. We have made a huge dent in the problem. We've vaccinated probably close to 70% of our population, but we still have a long way to go. It's our responsibility to do our part. Encourage your family members to be vaccinated, and in particular, children. Our children are our responsibilities, and we have to make sure that they are healthy. So it's up to us to encourage them to get vaccinated. And also, COVID it can be a deadly disease, but even if you have mild symptoms, we don't know. There's still ongoing studies to show that are looking at the long-term effects of COVID. You may have been asymptomatic, but who knows down the line, if you get this virus, we're seeing people develop these post-COVID symptoms, even if they don't have symptoms during the acute course of the disease. So you're putting yourself at risk unnecessarily by not getting vaccinated. The risk of COVID infection highly outweigh the risk of side effects from the vaccine. So it makes sense to do so, to get vaccinated.
Thank you so much. And Dr. Fletcher, your closing remarks, your final case, why get vaccinated?
Well, I want to focus on the teenagers and the children. You know, everyone says COVID is an adult disease, but I want to throw out some facts for you. 4 million kids in the US have been diagnosed with COVID. More than 500,000 of them were in the 0 to 4-year-old range. I know this vaccine is not available to them, but hopefully it will be, and that's a number to consider. And between March and April, the hospitalizations in the adolescent group doubled. There were 40,000 hospitalizations, and that's because people are reopening. People are not wearing a mask across the country, and the teenagers who are not vaccinated are the ones who are getting it now. And there have been, sadly, 300 pediatric deaths because of COVID-19. 4,000 of them also had MISC, which is a multisystemic inflammatory syndrome in children that causes heart disease. So this is a pediatric disease. And as parents, we always want to protect our kids. And this is the best way to do that. And then I have 3 points. It is summertime. COVID loves the fall and the winter. When do kids go back to school? In the fall and the winter. So keep that in mind. There are variants. We don't know what happens with the variants. It looks like they could potentially be more contagious and could also potentially be more deadly. And that could affect children even more than they are now. And then lastly, travel. If you are planning to travel to see family members in the summer or the fall for the next holiday season, you need to consider vaccination rates in rural America. It is very variable by state. And even internationally, there are many countries who have a very low vaccination rate and are high risk. So those are my 3 reasons why you should get your children vaccinated.
Excellent. Thank you so much. If I were on the fence, I think you guys did it. You guys convinced me. Those are some excellent arguments for vaccines. I want to just thank everyone again so much for your participation and sharing this evening with us and the excellent questions that you posed to our experts. I want to remind people that we will continue this conversation, and you have access to getting vaccines that are free, no insurance required, walk-in clinics available throughout Wake County at your pharmacies, at WakeMed Health and Hospitals and the Andrews Center from Wednesdays through Sundays, and almost daily at Wake County Human Services. So please do your part, and let's get back to our normal. So thank you all so much, and good night.